Hello, this is Dr. Patrick Hu from Moffitt Cancer Center. We're very happy to have Dr. Andre Beer-Ferlin here with us today. He is a neurosurgeon at Moffitt Cancer Center who is an expert in skull-based tumors. Thank you, Dr. Ferlin, for being here.
Thank you, Dr. Hu.
Yeah. Right, so tell us, what are skull-based tumors?
So skull-based tumors is the name we give for a broad group of different types of tumors that grow at the base of the skull. The base of the skull is the area that separates the bottom of the brain and the sinonasal cavity in the front part anteriorly. And posteriorly, it separates the bottom of the brain with the ear structures and the top of the cervical spine. These tumors can be benign or cancerous. They can grow in or around the brain, as well as inside and outside of the skull.
So tell us, what are some of the possible signs and symptoms of a skull-based tumor?
Symptoms vary widely from patient to patient, depending on the size, location of the skull base, and type of tumor that we're dealing with. The base of the skull is a region where cranial nerves, the brainstem, and major blood vessels are clustered in a small space. Hence, even small tumors that normally would not cause problems in different areas of the brain, they could cause debilitating symptoms when they're growing at this location. In general, most common symptoms associated with skull-based tumors are intractable headaches, altered sense of smell, vision loss or double vision, facial droop, hearing loss, balance problems, focal weakness, or difficulty swallowing.
So these tumors, how are they usually diagnosed?
So the diagnosis can be challenging when patients have no symptoms or only small changes in the normal body function that could be attributed to a different problem. For example, some headaches, which is very common in the population, fatigue, nausea, or blurry vision. On the other hand, it is less likely that a skull-based tumor diagnosis will be overlooked when symptoms are more significant, such as progressive vision loss, double vision, hearing loss, or focal weakness. Sometimes the diagnosis even come as an incidental finding, or meaning that was found by chance on the imaging scan that was done to address a different problem. But ultimately, when the symptoms are noticed, imaging scans such as a CT scan and MRI will confirm the suspected diagnosis with an accurate assessment on size and location of the tumor.
Well, this is such a complicated anatomic area. What's the treatment options for these tumors?
It's indeed a very challenging area because of vital neurovascular structures, and I mean, by saying that, I mean the cranial nerves, the brainstem, and the major blood vessels, they're very close together in a small space. So the risks of performing surgery and even radiation therapy at these locations are generally higher than in other parts of the brain. In addition, when we're doing surgery in these locations and when we're removing tumors at the skull base, we have very narrow corridors to work in, and we're often working in between very delicate structures, the cranial nerves, and blood vessels to remove the tumor.
At a specialized center like Moffitt Cancer Center, what's the approach to these tumors? I take it as probably a very multidisciplinary approach with different surgical teams and medical oncology teams. Can you outline this for us?
Exactly. So here at Moffitt, we have a unique multi-specialty treatment team. Since surgery has a significant role in the treatment of skull-based tumors, it's also important to have a surgical team that can provide all the surgical treatment options in an unbiased manner. And what I mean by that is that we can use open conventional approaches to resect these tumors, as well as minimally invasive techniques. One of our areas of expertise is the use of endoscopic, expanded endoscopic endonasal surgery, which is a technique where we use the endoscope, which is a small camera in the tip of a rod, and we go through the nostrils and to resect these tumors. But having all the surgical options in our toolbox allows us to select the safest, most effective, and less invasive approach to each individual patient.
Thank you, Dr. Ferlin, for your expertise in discussing this very specialized area of skull-based tumors. We really appreciate the information.